Westchester. You're on with Mayor Michelle Wu. Go ahead.
Hey, Catherine.
Hi. I was just wondering why entertainers and athletes are exempt from the vaccine passports.
Oh, entertainers and athletes are exempt?
Professional athletes I knew coming from out of town.
Yeah, we followed New York City's guidelines for the most part, in that if we were going to require vaccination of any visiting teams and athletes, we would effectively, as the city of Boston, be setting policy for leagues across the country. And so the goal of our policy was to boost vaccination rates, to use the power and the authority that city government has to close gaps in vaccination. And so that was a choice that we made, rather than try to upend all of national sports leagues across multiple leagues, to make sure that we were focusing on the parts that we could control. And I did, in the break, get from my amazing team some of the numbers I was not remembering off the top of my head earlier about the difference it has made. And so what Dr. Ojokuchu from the Boston Public Health Commission reported earlier was that we are now at over an 81% vaccination rate for the city of Boston.
Great.
That's been just in the last week, a 36% increase.
Wow.
Not from, 50-some to 81%, but 36% over what it was last week.
Did Catherine say actors are exempt?
Performers, yeah.
Performers.
Is that true?
So just as someone from a different sports team coming to play at TD Garden, we're not going to, again, try to set policy across the league. If someone is coming to perform at a theater, they themselves are not subject to the vaccination policy, but the audience is, and the crew and everyone working at the shows are.
Sarah in Boston, you're on with the mayor of Boston, Michelle Wu. Welcome, Sarah.
Hi, Mayor Wu. I am born and raised in Boston, and truly I'm brought to tears by the shameful policy you've enacted, ushering unprecedented segregation and discrimination, ironically, on MLK weekend. And you can probably hear the distraught in my voice. I never thought I'd see this day, especially in Boston, a city I love so much. And ushering this in, especially on the heels of the CDC director going on CNN saying that these vaccines no longer stop transmission, or, people can acquire it, and we've seen that. Everybody's testing positive. And also, you've shown...
Sarah, do you have a question?
Athletes. Yep, this is my question. You've shown through protecting athletes and celebrities that there is a protected superior class. Could you speak to this, and on the heels of the failed vaccine? So I'll let you talk now, but I'm very distraught.
Thank you for calling, Sarah. And I share your deep love for the city and wanting to do right by the city. I think we disagree on how to get there, and on the vaccine too. The vaccine is not a failed vaccine. It works very well for protecting residents and saving lives. I've spent time with our healthcare leaders and been in emergency rooms and was at the intensive care unit at Tufts Medical Center, where the staff, again, who have been doing this for 18 months now at this point, pointed to the board of names of people who are hospitalized, and they said 90% of these residents who are currently hospitalized are here because of preventable severe COVID because they're unvaccinated. It makes a difference, and the vaccine is very effective. And even if there are more breakthrough cases with Omicron than with previous variants out there is still a lot of Delta out there. There's still a great need for keeping transmission low, for the benefits that we see when people are vaccinated, when they're less likely to be contagious, when they are shedding less virus. It makes a difference for all of us. One of the biggest concerns that I have is what I've heard from our healthcare workers, that we are still seeing our largest hospitals needing to push back other procedures because COVID cases are crowding out everything else. Again, preventable, unvaccinated residents needing intense care, sometimes 2 weeks at a time or more. They're saving lives every day that if we had just seen vaccination would not be in the hospital system at all. And because of that, everyone who has a procedure they need shoulder surgery, they they need some other treatment, that is getting delayed. And when those types of not immediately necessary or crisis level health situations are delayed, they get worse. And then the surgery that you need later is even more intense. And so we're going to be seeing and experiencing the ripple effects of having vaccination gaps for a long time, even past this surge and past the end of this pandemic. And so we're going to do everything we can at the city level to close vaccination gaps.
You know, I'll tell you, you know, it's fine to disagree with the policy. The fact that we are in January of 2022 and a person is still calling a radio show describing it as a failed vaccine is so depressing. It is, and I'm so glad, Mayor, that your first response was that it is not a failed vaccine because it is anything but. Do you? I was going to read one more email question, Marjorie. Is that okay with you?
Absolutely, Jim.
Judy from Auburn asks you told us a story when you were here not too long ago, right after you announced this mandate, about some of the grotesque response you're getting, racist, threatening, whatever. You've also, Judy from Auburn, you've also been subject to racial hostility and bias now and throughout your political career. And while it's hard not to let it affect you, you're human. Do you have any advice for young leaders who have faced hostility, bias, or outright harassment in policy and in other sectors, Mayor Wu?
So even in this most recent kind of back and forth and the kind of tenor and images and all that we've been experiencing, I was debating whether or not to speak about it because it brings a second wave of backlash. It brings more people saying, you know, you're trying to be the victim when in fact, you know, you're in charge and this and that. And what I've realized is that silence really can enable and empower people who feel that the way to get their point across or to express their strong emotion is through violating boundaries of decency, of what's appropriate, of what is a very appropriate disagreement. And so I've just decided to try to shed some light on what's been happening because I'm not the only one. This is happening too. And I hope that as our young leaders are seeing this, they know that I still wake up so thrilled and excited to do this work every day. It is the most empowering and most meaningful way to serve our communities is to be involved and to be part of decision making and to try to open up doors so that everyone can be part of decision making. So I call it out because I think it's necessary and that it's time to really try to restore some level of seeing the humanity in each other across our politics. But personally, I'm fine. My family's fine. I hope my neighbors will forgive me at some point. I used to drop off cookies actually to them, probably not to you, Marjorie, instead. But we will get past this. And it's important to help shape our policies, but also our politics. And I believe city government can do that in rebuilding trust and showing that these policies work and they make a difference in people's lives.
Mayor Wu, we really appreciate your time. Belated happy birthday, and we will see you in February. Thank you so much for your time.
Thank you both. Great to be with you.
Yeah, thank you very much. That was Michelle Wu, who is the mayor of Boston, and we very much appreciate her being here with us every month for Ask the Mayor.